Have you ever seen someone with a feeding tube and a pump and wondered why they have one? I'll give you some reasons why someone could have a feeding tube. The first one is congenital abnormalities, such as intestinal problems, sucking and swallowing disorders, and failure to thrive. Today I'm going to show you in 5 steps how to load a bag, how to use the formula, how to use the pump, and hand washing. The equipment that you're going to need is hand sanitizer, the formula, a feeding bag, the pole, and the pump. In my audience analysis, I have noticed there are several nurses that don't know how to load a feeding pump the right way. Let's begin with hand washing. Hand washing is very important. Normally you'd use a sink, but I don't have a sink here, so we're gonna use hand sanitizer. So you're gonna wanna rub it really good past your wrist, in your fingers, get all the crevices, because bacteria grows on your hands, and your patient can get a foodborne illness from bacteria, which can cause nausea, vomiting, and diarrhea, which could be fatal to a patient with a feeding tube. Now that we have hand washing down, let's talk about our formula. There are different kinds of formula that the doctor could prescribe for you or for your patient. It's a nutritional value because most of our patients that are tube fed are not able to eat by mouth. We're going to shake the can to mix up all the formula inside. Make sure there's no clumps or lumps. And you're going to take your towel and wipe off the top of it to get all the germs and bacteria off the top. Now that we've discussed the formula, we're going to look at our bag. In our bag, it is enclosed with a plastic cover, which keeps out the bacteria and germs and diseases. So you're going to want to take it out, open it up, make sure the tubing doesn't hit the floor. And there are measurements on the side of the bag, which will correspond to how much formula you put in the bag for your patient. We're going to close the clamp, which is the white thing right here with the red button. You're going to close it so that way when you put your formula in there, none leaks out. And we're going to take off the plastic piece at the bottom of the tube. Now that we've familiarized ourselves with the bag, let's put our formula in the bag. We're going to shake up the formula again, make sure none of it's settled. Open it, and we're going to open the lid that's on the top. We're going to pour the desired amount, and we're just going to go with a couple 200 cc's. Close the top of the lid. You're going to hold it up and kind of let the tubing fall a little bit. And then by gravity, we're going to hold the tubing over the wastebasket to let the gravity pull the formula through the bag. We're going to unclamp our red button, hold it up, and as soon as it's at the end of the tube, we're going to clamp it back off and try to do it as fast as possible so that way you don't lose any formula. And the reason you want it to be at the end of the tube is so that way you don't have air bubbles in the patient's stomach, which would cause gas and could cause nausea. Now that our bag's ready, let's look at the pump. First of all, we're going to hang the pump, or the bag, on the pole, and it needs to be 18 inches above the stomach. We're going to put our little tube in here and around the black wheel and up through the clamp. And at this time, you would normally put this tube into the patient's stomach. We're just going to put it here for right now. And we're going to turn on the pump with the little blue button. and there will be red letters going across. We're gonna hold the volume button, and this tells you how fast the formula will go into a patient in an hour. So you use the up and down buttons to set your volume. Then we're gonna press the dose button, and then when it comes across the screen that says dose, and then you push the up and down button for your desired dose, which corresponds with what's on our bag. And that's the amount of formula. This is how setting up a feeding pump correctly looks like. There are 5 major steps in setting up a feeding pump. I hope after today's demonstration you have a better understanding on how to set a feeding pump up. Oh well.
You got it under 6.